Today we say that, okay, if you lose 5% of weight, it's good for prevention of diabetes.
रोटी के साथ सब्जी नहीं खानी है, सब्जी के साथ रोटी.
Correct. Tip for patients who are struggling for losing weight, be motivated and you will find that you will succeed. I think you need to be mindful about what you eat, how you eat and how much you eat, planning and exercise, which is consistently to be followed, on a day-to-day.
Increased incidences of diabetes in patients who are thin, people who are diabetic, trying to lose weight, but have joint issues. How do they start, and what should be their approach towards?
And how you mix your foods with carbs is important. It's like salads, sprouts, greens, and you mix it with carbs. The absorption of the carbs gets delayed and they spike much less.
Diabetes and weight are closely linked, yet there are so many misconceptions around it. Is a weight gain actually a cause, a consequence, or a complication of diabetes? Can losing weight actually help you reverse diabetes? In today's episode, we unpack facts, bust myths, and explore how smart and sustainable changes can help you monitor body weight and blood sugar. But the real question is, are you ready to take that first step towards a lasting change? Today we have with us Dr. Sanjay Agarwal. With a career spanning over 4 decades, he has not only mastered the art and science of endocrinology, but has also helped numerous patients with his patient-centric approach. As a global thought leader, educator, and a pioneer in groundbreaking clinical research, Dr. Agarwal continuously shapes the future of treatment strategies around the world. Today, we have the privilege of hearing from a man whose dedication, wisdom, and passion have set new standards in medicine. A true pioneer whose impact resonates far beyond the clinic. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Sanjay Agarwal.
Hi.
Hello, sir. How are you?
Thank you very much. I'm fine. It's great to be here today.
Thank you, sir. We really wanted to have you on this show from such a long time, and just fortunate to have you for the first time in our show. So, we are going to talk about diabetes and weight management today. But before I get into that topic, 40 plus years dedicated to endocrinology and, mastered everything about diabetes. How has this journey been for you?
Thank you very much, Tushita. It's really a great pleasure and honor to be here on your show.
Thank you, sir.
And I was also looking forward to be with you and have this conversation. Yes, to answer your question, it's been a great journey in the field of diabetes, right from my formative years when I sort of passed out as an internal medicine specialist. But something drew me to the world of diabetes, and I felt that, that was my calling. 40 years of practice in diabetes has been a great journey.
And you have seen the, treatment modalities and everything changing.
Absolutely. When we started out treating diabetes, there were very few drugs.
Yes.
And our understanding of diabetes was very limited. But over a period of time, there has been such a huge change in our approach to diabetes, right from understanding diabetes, the way we monitor patients. And now, of course, you've got a whole flood of, treatment options that we can give patients. So it's today, at least, when any patient comes to me, it's hard to say that I can't control your diabetes. And I have been privileged in my 40 years to have come across so many thought leaders, nationally and internationally, whom I've worked with, right from, clinical medicine to research, and interactions with all global thought leaders, that I have learned so much over the time, and I keep learning even now, because everybody and every patient and every doctor and every thought leader keeps contributing to my knowledge, and I feel I'm enriched with that interaction.
Hats off to you and your dedication and all these years that you have given to diabetology. Now, without further ado, let's dive into today's topic, which is weight management and diabetes control.
Absolutely.
So, what's the link between these two?
So I think weight and diabetes are extremely important, right? and various studies have shown that as weight goes up, the incidence of diabetes also tends to go up.
Acha.
Right? And if you lose weight, you also improve on your blood sugar control. So that's no brainer about it. What starts out as just a simple weight gain is basically a lot of accumulation of fat mass. And fat mass prevents your own insulin from working.
Acha.
Right? So as you gain fat, the body tries to compensate to keep your blood sugars fine by increasing more and more secretion of insulin. So it's trying to overcome the insulin resistance which the fat sort of puts into the body.
Okay.
And up to a point of time, your blood sugars stay good, but there is a kind of a fatigue of the pancreas that tends to happen when it's not able to match the weight, and then you fall off the curve because you start reducing your insulin output from the pancreas. Your insulin resistance remains the same, and then you find that your blood sugar starts climbing up.
Okay.
Now, at the right moment, if you correct this action and you get your weight down, your fat mass down, you'll find that your own insulin is able to compensate enough and keep your blood sugars well.
In control.
Right?
So approximately, weight management or a weight loss of around 5 to 10%. That also makes a difference?
Absolutely. So we have, earlier we used to say that, lose 30 kilos of weight and 40 kilos of weight.
Those are
And
like
that
big
was rather
targets.
intimidating for a patient.
True.
And it was a sort of a, patients would get demotivated and say, I can't do it. And I won't be able to do it, So today we say that, okay, if you lose 5% of weight, it's good for prevention of diabetes. It's good if you have diabetes to improve control and get your medications down. It is also good for preventing cardiovascular risk and other risk factors. And I think it's a great way to go. Now, if you lose just an additional amount by 10%, then we talk about diabetes remission.
Acha.
Right? And you can get by 10 to 15% of base weight reduction, a diabetes remission that can happen.
Acha.
Right? And if you lose about 15% of weight, then you can reduce the mortality and all the comorbidities that are associated with obesity and diabetes.
Okay.
So it's not so hard when I tell patients, look, you have an X amount of weight. Why don't you just lose 5% of your weight
of that weight.
in the next, let's say, 3, 4, 5 months, which is not so difficult for a patient. And he says, look, I can do it. Why can't I just do this and let me make an attempt to do that? So it is beneficial.
Yes.
Every amount of weight that you lose translates into some benefit or the other. So I don't think we should say that, okay, large amounts of weight are required for good health.
Start
In
with
small
baby
amounts,
steps.
yes.
Start
Start
with
with
baby
small
steps.
steps at least.
Yes, sir. So we have also, in my latest one of the podcasts, one of our doctors were also talking about that increased incidences of diabetes in patients who are thin.
Yes.
So what do you have to say about that?
So it's a misnomer to think that thin people can't get diabetes.
Yes.
Now, let me give you some of the case scenarios where you can get in thin people diabetes. For example, you have type 1 diabetes.
Acha.
Now, most of these patients who have type 1 diabetes would tend to be thin,
Acha.
right? And you find that these patients would tend to develop, diabetes because of an immunogenic condition where they lose their pancreatic ability to make insulin. The other thing is where the fat is equally important. You find that you have thin phenotypes and that they're metabolically fat, and that's because where the ectopic fat is located is most important.
Acha.
So you have thin people with a lot of big bellies.
Belly fat.
Yes. All right. And these belly fats that they've got is because they have a lot of fat in the organs and particularly the liver and the pancreas. So we call it a double whammy where you've got a high amount of fat in the liver, which prevents your own insulin from working. And you have a high amount of fat in the pancreas, which sort of retards the secretion of your own insulin. And then you've got other rare conditions where, you've got malnutrition related diabetes. And today, if you've been hearing the news, that's what we term as type 5 diabetes,
Acha.
which has been announced by IDF as a terminology.
Acha.
Not that we didn't know about this condition. It was existing earlier. It's just been reclassified as type 5 diabetes by the International Diabetes Federation. And we call this as a malnutrition related diabetes. So these are interesting situations where we tend to have
person can be
thin
thin,
people
but
and can
still
have
be diabetic.
diabetes. Yes.
So when the in the process of weight loss, what's the role of protein intake in specifically in this diabetic patient who want to lose weight but
Yes.
not lose the muscle mass?
Correct. So I think proteins are extremely important because
Mhm.
let's say when you're looking at high amounts of weight loss,
Mhm.
okay, over a period of time,
Yes.
you lose a lot of fat mass,
Mhm.
but you also start losing
Mhm.
a muscle mass along with it. Now,
Mhm.
this has become more sort of prominent because given the newer drugs of age that we've got of GLP-1 analogs,
Mhm.
where we are talking about losing 15% of weight loss, 18% of weight loss, or 23% of weight loss,
Mhm.
where you're doing a lot of aggressive, weight loss
Programs
strategies.
and
So you
strategies.
do lose weight by
Acha.
losing fat,
Mhm.
but you also start losing muscle.
Muscle
Now,
mass.
if you see some of these patients who lose tremendous amount of weight,
Mhm.
they start getting frail. And because they start getting frail and they lose muscle mass, the risk of falls and fractures and all these tend
It's
to be
very
extremely
high.
high.
Yes.
So we always say that when you're losing aggressively weight, you need to supplement a lot of proteins and you need to do a lot of strength training exercises to build the muscle mass. And for building the muscle mass,
Mhm.
proteins are the substrate that you require
Mhm.
very necessarily. So
Mhm.
we'd say take about zero point 0.8 to 1 gram per
Mhm.
kilogram of protein if you're losing aggressive weight loss, because that's required for the muscle buildup.
Sure, sir. So when we talk about weight loss in, particularly patients who are diabetic and are obese, so obesity obviously puts a lot of, impact on the joints. So what do you have to tell about those people who are diabetic, trying to lose weight, but have joint issues? How do they start, and what should be their, approach towards this?
So I think that's a very interesting question, and I think it is necessary that people should know that fat doesn't mean fit.
Hmm.
That's number one. All right.
True.
Now, people just because they look big
Hmm.
doesn't mean that they have strong muscles. And we have something what we call a sarcopenic obesity. And when we
Sarcopenic
talk,
obesity.
yes,
Okay.
when we talk about sarcopenic obesity,
Mhm.
these are people who have got a large body, large amount of fat mass, but they have very small muscle bellies and they are sarcopenic. So they have less muscle mass,
Acha.
right?
Mhm.
Now, sarcopenia is something that we rarely screen people for, but it should be done.
Mhm.
And the simplistic way of doing it is you can ask them to do clinical tests that, okay, how rapidly can they get up from the chair and stand? How quickly they can make a circle and come back?
Mhm.
Are they able to get up, from the bed without, holding the sides? Can they
Mhm.
get up from the chair without holding the sides? Can they go up and down the
Mhm.
staircases? Right?
Mhm.
Or you can do with dynamometers hand grips, right? Now, when you lose a lot of muscle, you're putting a lot of strain on your weight bearing joints.
Yes.
And when you have a lot of weight, that is transmitted onto the weight bearing joints, there's a faster wear and tear that tends to happen, and people tend to develop osteoarthritis
Osteoarthritis and
pretty fast.
landing up into TKRs and all that
Correct.
stuff.
So if you build up a lot of muscle mass and strength training,
Mm-hmm.
you're offloading your joints to a large extent,
Mm-hmm.
and you're able to sort of buffer the weight by your strong muscles,
Correct.
right? And
Yes.
posture maintenance is extremely important. So you
Mm-hmm.
find, and this is now getting more and more realistic because we do a lot of body composition analysis in a
Mm-hmm.
patient.
Mm-hmm.
And when we do body composition analysis,
Mm-hmm.
we're actually able to map out how much of fat mass is there, how much of muscle mass is there, what is the distribution of this fat in the body,
Mm-hmm.
how the distribution of the muscle mass is the gait balanced or not balanced, what is the water mass in the body. Now, if you have people whose gaits are not balanced,
Mm-hmm.
then they'll tend to wear out one joint
Yeah,
more
one
than the
joint more
other,
than the other.
and they would be at a risk for then falls and fractures. They also tend to put a lot of strain on the spine, and they tend to develop a lot of back problems and spine
Spine
problems.
problems.
So these are some things that we should be very careful about when we are talking to people who have got obesity and
And the
diabetes
joint issues.
and joint issues.
So, sir, can exercises in diabetics lead to lower sugar levels?
Definitely, because on one hand, while we say that, okay, there's a lot of muscle activity that tends to happen,
Yeah.
and their muscle needs fuel
Hmm.
for burnout, right?
Yes. Yes.
Anything, you have a car and you drive, you need
You
petrol,
need fuel. Yes.
correct? Where does that fuel come from?
Mm-hmm.
So you burn out a lot of carbs and you burn out a lot of blood sugars and the insulin is the mediator for that, right, through various metabolic pathways. And if you exercise, you're burning out a lot of fuel, and the fuel that comes is from the blood sugars. So it helps you to improve on your utilization or optimum utilization of your blood sugars, right? And this helps to bring the blood sugar down.
So when it comes to the diabetes medications, right? So is it true that these medicines also leads to certain amount of weight gain?
Yes. So we have three classes of medications that are available today. One class is that are weight neutral. All right. And if I have to name them, then that's metformin, voglibose, alpha glucosidase inhibitor class of drugs. These are all agents that will have a weight neutrality, or for that matter, DPP4 inhibitors. These are all weight neutral drugs. You've got drugs that induce weight loss. And the drugs that induce weight loss are your SGLT2 inhibitors and the GLP-1 analogs.
Yeah, actually, I was coming to that. What's your thought on GLP?
I will be talking about it.
Yeah.
And then the weight increasing drugs are your insulins, sulfonylureas, TZDs. These are all drugs that cause a weight increase to happen as they bring the blood sugars down. And higher the dose, the more the weight gain that tends to happen.
So what's about this GLP drugs?
Oh yeah, I mean, these are the incretin class of drugs. Now all of us make GLP-1 and GIP-1s in the intestines, and these are from the L cells of the intestine. So when we eat food, then we activate these these hormones from the gut. Now GLP-1 that is there in our which is released, that has an action on the pancreas to improve the insulin action and to increase the insulin output, right? It also sort of has action on the GI motility. And it causes regeneration of the pancreatic islet cells, the multiple function that the GLP-1 does. So we all have GLP-1s, right? Now, it has been shown that this GLP-1, when synthetically made, has accentuated action for a longer duration of time. So we've had drugs that you require to give every day, and then you've got drugs that the GLP-1s that you need to give on a weekly basis, and you've got oral GLP-1s and you've got injectable GLP-1s, yes. Right? Today, other than we have seen that other than just blood sugar control, these drugs have come to play a large role in reduction of fat mass, obesity,
weight management,
and weight management per se.
Yes.
And I think perhaps we are now seeing a utilization of this class of drugs more for weight management rather than diabetes management.
Okay.
Besides that, this class of agents have also shown through various trials to reduce cardiovascular risk and re-event rates, or if you say reinfarction rates or cardiovascular event rates.
So
these, yes, it has also effect on the kidneys. It has, so much other, they're now discovering more and more actions of the GLP-1. But for example, when we have patients who have a cardiac problem, at risk for cardiac problem or have suffered from a cardiac problem, they have diabetes, they've got weight problem, then the first line of agent is to give GLP-1 analogs for these patients.
Yeah. So when it comes to the weight management, one of the things which is really trending right now and everybody is trying to do it is intermittent fasting. So can a diabetic also do intermittent fasting? What's your thought?
So it's been always a debate that, okay, what helps patients? Is it time restricted eating or calorie restricted eating that we really want to talk about, right?
Yes.
There has been a lot of data that shows that, time restricted eating works, right? And the most common way that we do time restricted eating is intermittent fasting, and we say 8 hours. So you eat for 8 hours and you sort of fast for 16 hours. But it's not necessarily fast. You're allowed certain things, like you can have lime water, you can have buttermilk, you can have 0 calorie liquids as such. But for 8 hours you can consume food. Now
that also has to be calorie restricted.
Correct. So you have to, of course, plan that food also.
Yeah.
It used to be, okay, what should be the 8 hours that you should be doing the restriction? And there are studies to show that You can choose your 8 hours in the day that you
Mm-hmm.
want to do a
Mm-hmm.
restricted eating,
Mm-hmm.
and all of them work equally well. So it's not mandatory that people do, okay, from 12 to 8, 12 noon to 8 p.m.
Mm-hmm.
That's the fasting time, the feeding time that they do, and rest of the time is the fasting time. But now studies have shown that you can do 8 hours of any time in the day
Mm-hmm.
where you do eating, and rest of the times you don't eat,
Huh.
and they all equally have effect in terms
Effects.
of weight reduction as such.
So, what's one common mistake that you see people doing while they try to manage their weights?
I think the one common thing that people do while managing the weights is that they would be very aggressive initially because they are motivated,
Yeah, and then
but it's
eventually
very
the
difficult to sustain that,
sustain.
right? And they would continue for a period of time, they'll
Mm-hmm.
see the results,
Mm-hmm.
they will improve,
Mm-hmm.
and then gradually you find that the weight starts creeping up, and you ask them the question, yes, I did have something to eat the other day, I
Mm-hmm.
did not go to the gym or exercise because I was traveling. And then slowly that motivation for lifestyle tends to get lesser and lesser.
True.
And when that happens, you start gaining the weight. Remember, whatever you do for your weight loss,
Consistency.
there has to be consistency, discipline, and it has to be maintained permanently. The moment you stop doing it,
Mm-hmm.
you will find that the weight tends to creep
Tends
back.
to creep back.
So we always say that preventing weight gain is always the mantra. Losing weight is always the more difficult task to sustain and to initiate.
True.
So if you find that you have healthy habits, when you're not obese,
Mm-hmm.
you're going to fight obesity much more effectively
Mm-hmm.
and sustain that, rather than you go on a backward journey
And
to
lose
say,
it and then try to
and
sustain.
then to sustain it.
Sure, sir. Okay, sir. So that's about weight management and diabetes. And now moving on quickly to the next segment of this podcast, which are rapid fire questions. So I shoot some questions at you and you try to give me a crisp answer as much
Done.
as possible.
Absolutely.
So are you ready?
Absolutely.
Okay. Myth or fact? All overweight people eventually develop diabetes.
Not necessarily. Not all obese people have diabetes, because what is important is the location of the fat. People who have visceral adiposity, yes, they have a high incidence of occurrences of diabetes. People who have got a high amount of subcutaneous fat, they have shown that they have a lesser incidence of fat,
Okay.
obesity.
You can reverse type 2 diabetes just by losing weight. Myth or fact? I think I know the answer, but
It's
still.
a fact.
Yeah.
Yes, absolutely.
Does insulin cause weight gain or is it the way to use it?
Insulin does cause weight gain, and that's because it's an anabolic hormone. So, if you use insulin and larger amounts of insulin, there is definitely an increment in the weight that happens.
Mm-hmm.
So, you've got to be careful that you follow certain lifestyle principles with diet and exercise when you are on insulin. Also, when we plan insulin treatment, we try to counteract the weight gain by giving collateral drugs
Mm-hmm.
or associated drugs which will offset the weight gain. So, you may use a GLP-1 analog with that, or you may use a SGLT2 inhibitors with that. So, that kind of offsets the weight gain that you may get. And as well as, of course, ask the patient to do a lot of strict diet and exercise.
Sure. One lifestyle change that makes the biggest difference for weight loss in diabetics.
Zip your lip.
That was good one. Carbs. Cut them completely or control them smartly.
I think control them smartly is the way to go, because you've got foods that have got a high glycemic index. There are foods that have got a low
Low
glycemic
glycemic index.
index,
So
right?
choose
So
smartly.
choose, and then how you mix your foods with carbs is important. So if you use, let's say, carb blockers like salads, sprouts, greens, and you mix it with carbs, the absorption of the carbs gets delayed and they spike much lesser.
Acha.
So it's absorbed over a duration of time and you don't get as much of spike in the blood sugars. So how you combine foods is equally important, and what kind of foods you eat, whether they have a high glycemic or low glycemic index, that's equally important.
So रोटी के साथ सब्जी नहीं खानी है, सब्जी के साथ रोटी.
Correct.
Correct. Okay. True or false? Thin people don't get type 2 diabetes.
That's false. I just
We had
said
an
that,
elaborate
yes, yeah.
discussion on this. Okay. Your go-to tip for diabetic patients struggling to lose weight.
I think the go-to tip for patients who are struggling for losing weight: be motivated. and you will find that you will succeed. I think you need to be mindful about what you eat, how you eat, and how much you eat, and spend some time of your day planning an exercise, which is consistently to be followed, on a day to day. We say 150 minutes per week is good, right? So people who feel that I can't do it every day, even if you do it 3 days a week,
Is
I
good.
know it's good enough,
But begin
right? Okay,
somewhere.
but begin somewhere.
Correct. So as we talk about eating, what's worse for weight gain? Emotional eating or insulin resistance?
Emotional eating, okay. And people who are depressed, people who are stressed out, they do a lot of,
Emotional eating.
yeah, hedonic eating that we call about. They will just keep eating because to overcome stress or anxiety, people do a lot of defensive eating, particularly on, let's say, insulin, right? And they find taking insulin very stressful, and some of them are stressed about the
Yeah.
fact that they will go low in terms of the sugar, and they start doing a lot of defensive eating and they gain weight. So I think emotional eating is extremely
Is
important, and
worse.
we need to caution our patients about it.
One weight loss myth you wish would just disappear.
I can't lose weight.
Can someone be metabolically obese even if they look thin?
Yes, I did answer that question, because when you have a lot of liver fat, you have got a lot of pancreatic fat or an ectopic fat, then these are patients who are metabolically
Probably
obese,
obese. But they
and
might be
they
thin.
they may be thin, and this is typically what we call the Indian population as thin fat Indian.
Thin fat Indian. Eating late at night directly causes weight gain in diabetics. Myth or fact?
No, it's absolutely a fact, because we do have studies to show that diurnal eating patterns. So people who tend to have a larger portion of the meal in the daytime and a smaller frugal portion at night tend to lose weight.
Acha.
And people who tend to eat majority of their food in the evening time and late evening, they tend to gain weight.
Gain weight.
Also is the fact that because in the late evening, when you eat a lot of calories, you're not exercising enough to lose them, and that causes a lot of weight to accumulate. Whereas in the daytime, you're always on the go, active, so you tend to sort of burn out all those excess calories too.
Sure. One trendy weight loss trick or too much in weight loss regime you would never recommend to a diabetic patient.
Don't go into food fads where people are looking for quick fixes. So people will say, I'll starve myself, or I'll go on a liquid diet completely, right? These don't work, right? Your body has a feedback mechanism. The more rapidly you lose weight, there is a feedback mechanism that
Chances of
kicks in,
eating
and there is
coming
a
it back.
neurohormonal mechanism that is there. It aggressively kicks all your weight back, right? So a slow reduction of weight, gradual, will allow your body adaptations to happen, and you'll probably find that you'll be able to sustain the weight loss much faster, much easier.
Much easier.
But please do not look for quick fixes, and whatever you do it all your life.
Thank you, sir. That's about weight management and diabetes. It was a wonderful discussion, and we were really happy to have you on this podcast with us.
Thank you.
And
You're a great anchor and a great host.
oh, thank you
Thank
so
you.
much. That's you just made my day. So looking forward, because I have so many other topics to discuss with you. So looking forward to have you again on this podcast. Until then, we wish you all the best, sir. Thank you so much.
Thank you very much.
Thank
Pleasure
you.
being here.